the ANA can be positive. The RA can be positive. The lupus can be positive. And then you get rid of the tick-borne disease and all those positives turn to a negative. And then the rheumatologist said that it was a coincidence. And it's like, no, this was not a coincidence.
Living with autoimmunity doesn't mean settling for less. Inspired Living with Autoimmunity is the show for high achievers who want the energy and vitality to live fully, not just manage symptoms. With your host and autoimmune coach, Julie Houghton. It's time to take your power back.
Pam, welcome to the podcast.
Thank you so much for having me. I really appreciate it.
It's such an important conversation, and I'm so excited to share your work because I know so many people without even having to give it a lot of thought who really need you. So thank you for taking the time to join us today. I would love to hear a little bit. You did not start out in functional medicine, but I know you have an amazing why. And so I would love for you to share with listeners a bit of your journey and how you got into this world of chronic inflammation, Lyme, and more.
Sure. So I was an ICU nurse. I use obviously a lot of medication to save people's lives. When I went back to school to be a nurse practitioner, I did the acute care track. So I worked as a hospitalist. I worked in the ER in the intensive care unit in the Department of Surgery. So again, it was all life-saving reasons why I was there. I went to work for a physician after I got tired of working all the weekends and the holidays, and I really never did primary care before, so I was shocked at how poorly these patients were being managed. Mm-hmm. And so I, before opening up my own practice, I, tried to get these patients on because it was a physician's practice of over 40 years that I had taken over.
Oh, wow.
And the remaining physician still hasn't retired. And so they needed somebody who could round in the hospital, admit, discharge, and things like that. That's how I ended up getting the job. But what I found was that the majority of people, had either uncontrolled diabetes or they were pre-diabetic and they didn't know it. And what I found is that nurses and physicians have two different ways of doing things. Physicians wait for the disease process to occur and then they treat it, where nurses try and prevent the disease process from the beginning and try and correct it. And so after I graduated with my master's degree as a nurse practitioner, and I went back to school for my doctorate degree, and my research was on preventing the progression from pre-diabetes to diabetes. So it was a retrospective analysis of what I had done in that practice, and it was actually statistically significant. And then from there, I went back to school for functional medicine because I realized, if people had a really good primary care doctor, they wouldn't even end up in the hospital. And functional medicine was almost like an extension for me for nursing. So it was all about how the body works, how it can actually heal itself, supplements to use to try and encourage that. And I started my own practice in 2016. And in 2017, my son started having a lot of issues. He was 19 when he had hernia surgery. And right after the surgery, it was like hell's
just the wheels fell off.
Just opened up for us. It was just awful what he was going through. The joint pain, the brain fog, the inflammation, difficulty urinating, trouble with his bowel. I mean, it was just everything. And so now we're taking him to so many doctors over a 10-year period, and nobody could figure out what was going on with him. And meanwhile, I'm researching everything I can find to figure out what's happening to my son. And, I can't find anything. And then the 10th year, he was 29, I found one research article in the Journal of Urology. It was a case study on another male patient who had my son's exact symptoms. So I contacted the researcher who referred me to the International Lyme and Associated Disease Society, and I became a member. I found Dr. Richard Horowitz, a Lyme expert who trained me. I did my preceptorships with him, and that's how I saved my son. The whole time he had Lyme disease, and he had gotten it's all in your head diagnosis.
Yeah.
About a year before I had diagnosed him, and when I told him I knew what this was, this had to be Lyme disease. He said, "No, Mom. They told me it's all in my head." I get emotional just talking about it. They said it's all in my head, and I said, "No, it's not all in your head. You actually
in your
have
body.
A disease that is causing all this." And so he had gotten bit by a tick when he was 6. He had a bullseye rash. I brought him to the pediatrician, and if I have to guess, he was put on antibiotics for about 10 days, 14
standard.
tops. That was it. He had no symptoms, besides that bullseye rash, he had no other symptoms whatsoever. He could have gotten bitten by another tick because now he went through his teenage years.
Sure.
But while he had the hernia surgery, the surgeon actually left the operating room with him on the table to talk to me to find out if he had a connective tissue disorder that I didn't share. And I said, no, he was a healthy kid. We had no issues at all. He described his abdominal wall like Swiss cheese. He said his exact words was, it looks like something is eating him from the inside out. And come to find out, there was something eating him from the inside out, and it was bacteria. And so the bacteria from Borrelia, which is Lyme disease, actually uses your proteins to survive and to create a biofilm where they can, build their own housing structure inside your body. And this biofilm is impenetrable from anything, antibiotics, immune system, even IV antibiotics cannot penetrate this. So there is a researcher, her name is Eva Sappi, out of the University of New Haven, and she's a botanist by trade. And she had done a lot of research with Petri dishes and just trying to break open this biofilm. And she tried pretty much everything, including gasoline and bleach. Not that you can ingest those things, but she actually tried anything to open up these biofilms. And what she started... Exactly. And she finally started using plant extracts and found that the stevia plant actually is what broke open these biofilms. So when she tried this research in people, it didn't work so well. So she brought all this research to Dr. Horowitz's office where they did clinical trials and found that in a human being, you had to add serrapeptase or nattokinase, which is a derivative of silkworm. So for a silkworm to break through a cocoon to become a moth or a butterfly, they have to excrete this serrapeptase to be able to open up the cocoon. So when that's taken internally, it actually eats away any non-living structure, including biofilm. So between the serrapeptase or nattokinase and the liquid stevia, it breaks open the biofilm and then it targets those persister cells.
Wow.
So that's
how is your son now?
Healed. Fantastic. Thank goodness. He's 38 years old now. He is doing so much better than he was. We just did a round of antiparasitics, and because he still has some bladder and some pelvic fullness, he feels like he still has some congestion, and the antiparasitics seem to work fantastic for him.
Nice.
So I'm wondering if now he has some type of a parasitic disorder as well, which is rampant. But if you talk to any doctor in the United States, they'll tell you that you don't get parasites unless you travel outside the United States,
right.
Which is
really we all have parasites. There's the other, the other thing you hear a lot. Yeah. Yeah.
Yes, true. And they could just survive in your body and doesn't cause any issues, which is completely false as well. Yeah. So there's a lot of misinformation that's on the internet and a lot of very, doctors, physicians who come from, big medical centers, so they have the name behind them are giving this false information.
Right.
And they don't realize it's false information. They really believe that these things are true, which is really
sad and scary.
Significant and very scary.
Yeah.
Yes,
well, and
exactly.
Even just it's all in your head. So many of our listeners in the autoimmune world have heard that, or it's been implied, if not directly stated, right? Your labs look fine. Exactly. And so that was one of the reasons I was so excited to talk to you, especially, when it comes to Lyme, we were saying before I hit record, years ago I was told, there's no Lyme in Colorado. There's no mold in Colorado.
Yes.
First of all, we all travel, number one. Number two, I grew up on the East Coast. So it doesn't matter where I live now. But I want
exactly. You're right.
I want to highlight, you mentioned your son, had a bite, got a bullseye, got treated, was asymptomatic. And can you prove, could he have been rebitten? Sure. But I'm guessing you see this a lot of all of a sudden, years later, something can trigger where the Lyme will pop up or a co-infection.
So for him, every test was negative. So I sent his blood work out to Germany first to Armin Labs, and there was no Lyme disease. I sent it to IGeneX in California. It was negative there. But I knew it was Lyme because I had talked to this urologist who had did the case study. And so now I'm a part of ILADS. And once I was a member, I was able to go into the older meetings. I had to pay for them. But I went to the older meetings, and there was a Dr. Joseph Burrascano, who I'm very friendly with now, who was talking about the natural killer cells. So it's called an HNK1 test. And that number should be between 60 and 360. If it's below 60, you're going to get a false negative because your immune system isn't strong enough to show a positive result. Well, my son's HNK1 was 10. I have never had a patient with that low of a level since him. So there was no way he was going to test positive for Lyme disease because he didn't have enough natural killer cells in his body to actually make that test a positive test. So he was on antibiotics for about 3 years before his HNK1 reached 60, and that's when I retested him, and the IGeneX came back positive.
Wow!
So that's helped so many of my patients now. You know, and interestingly, my second year with ILADS, I was doing just a quick little, question to the nearby providers to find out, like, how did you get involved with Lyme disease? Because nobody seems to know anything about it.
Right.
And every one of them, it was a family member.
Yeah.
So every single one of them was a family member that, they're given the it's all in your head diagnosis. Nobody can figure out what's going on with them. And then they take it upon themselves to do the research and try and figure out what it is, just like I did. And that's how you become a Lyme expert.
Yeah, unfortunate, but fortunately for the rest of the world.
Fortunately and unfortunately, all at the same time.
We don't necessarily pick our passions. Sometimes it's survival.
And now I am so passionate about it. My husband tells me to get off my soapbox every so often when somebody we see and asks me a question about a tick bite or something, and then I just go off on my tangent.
2 hours later, yeah.
Exactly.
Well, and I do think it is such an important. First of all, I want to highlight so many things that you said because often good testing is expensive, and it's often very inconclusive, and so yet. You do still test, I hear, right? But you know what you're looking at and looking for as well.
Correct. So if I have a patient who has all of the clinical signs of a tick-borne disease and their HNK1 is below normal, I'm still going to treat them.
Yeah.
I just have to make sure I document my notes very well because our government is not like people who treat Lyme disease. I have no explanation for that whatsoever. So my attorney just said, make sure that, he said, how did he say it? Pretend the Department of Public Health is on one shoulder, a lawyer is on the other shoulder, and make sure that they're both looking over your shoulder, that you are documenting everything. And that's what I try and do. And do I do it perfectly? No. My main thing is my patient. My documentation is secondary. So I try and remember everything to document. But my big thing is to save this person's life.
Yeah. And it is getting, I run a functional medicine clinic. My husband's a physician. And so I will say our documenting has come a long way as well because he's been out of the insurance model for so many years that, he hasn't had to document. But now I'm like, no, we just for that reason, we need as many notes as we can get there. Yeah. Yeah,
that's exactly it. And I think it's so important too. And good documentation is going to help with so many other reasons. I mean, there's times when I have a patient and I honestly don't remember what happened last time, so I can look back at my note and remember exactly what the conversation was. So, I mean, all the way around, it's so important to document properly. Yeah,
but it takes a little practice sometimes.
It does.
Especially when you are really patient-centered and not in the box. Yeah,
exactly. You're absolutely right. Because if you're taking insurance, let's face it, you see a patient for 15 minutes, you have enough time to review their labs and either prescribe a medication, add a medication, or change a medication. And that's about it. Yeah. So when you are not taking insurance, you are really trying to help this person in every possible way. When I went back to school for functional medicine, that was such an eye-opener for me. Not only did I learn about, how the body heals itself and, preventative medicine and things like that, but, mold, mycotoxins, there's so many things that affect the body that people don't even realize. Just going to school, or working in a school system, all the mold associated with that school, all the symptoms associated with that mold, and it's not like, you get the asthma or the chronic sinus infections like you would expect from mold. These are such changes in the body that people can't even identify. So the patient I generally get is literally a hot mess. Like, I don't even know how else to say it. I have some patients come in, they have seen so many doctors over so many years, and they are taking 20 plus medications, and some of them are causing so many other side effects.
Sure.
That my first job is to try and get them off the medications that they absolutely don't need.
Right.
There's certain meds you should never come off of. I'm certainly not going to touch those, but the vast majority you really don't need. And then I kind of see where everything falls, and then I start doing testing to see what have I missed so far.
Yeah, I was laughing in my head because I happen to have seen, I know you use like Intellix DNA in your practice, and I'm thinking 15 minutes to go over labs. Yes. That's fine if you're doing a CBC, yes. But no, because we use Intellix as well. When you're doing in-depth, yep. and we can chat about that difference of so many people are told your labs are fine, your labs are fine.
Mm-hmm.
You're totally. It's to even say it's a deeper look. It doesn't even do it justice. But one of the reasons I think this I have a different lens than you, although listeners have heard me share before. Like my father passed away from what I truly believe were. It was impact from Lyme. This was back in the early 90s, and he was allergic to penicillin, and it was just a struggle. My brother had so many bullseyes, they thought it was a rash because because we lived, out in the country, and the deer were everywhere. All of my kids have had Lyme at some point, and the reason why so I probably don't see Lyme everywhere like I would imagine you do, and it's because it's there. I mean, it is there. But I want people to understand the different drivers of autoimmunity. Right? Like, people ask me all the time, well, you're symptom free now. Did you not have RA? Were you misdiagnosed? And I'm like, I don't know. I mean, I know if I went back to the lifestyle I was living back then, I would be sick again. Like, I know that. The label to me, because I don't live in the label medication world. So I think it's so much more common that there's overlooked Lyme and or co-infections going on, at the very least fanning the flames of somebody who might classically fit an autoimmune diagnosis as a trigger.
You're absolutely correct. And the ANA can be positive. The RA can be positive.
Yeah.
The lupus can be positive. And then you get rid of the tick-borne disease, and all those positives turn to a negative.
Yeah. Say that again.
And then the rheumatologist said it was a coincidence. And it's like, no, this was not a coincidence. Yeah. This is because these infections were driving the autoimmunity, because it was tricking the immune system into thinking that it was something else in the body, and it just started attacking itself. Yeah. So once you get rid of the bacterial infection, the parasites, the mold, the mycotoxins, the MCAS, there's so many things that go on in the body that mainstream doctors just are either they're not aware of it, or they just don't have time to sit there, especially if you're taking insurance. You have 15 minutes to see a patient, right? But unfortunately, they also don't refer out. And I think that that's the biggest problem, is if you don't have the time or you don't have the knowledge, then you should be referring out to somebody who does. Yeah. And let me tell you, the knowledge was not easy. I mean, this is over, I've been doing this now for 10 years, and this was every day I'm learning something new.
You're living this.
A real lot of learning.
Yeah. And it continues because
it definitely does every day.
Yeah. It's amazing. So I want to talk a little bit about, when you were talking about mold and the symptoms, I think all the time, like I can have a conversation with somebody and on a consult or an initial, like deep dive, and I'm trying to go through history and intuit, like, what do I think is really driving? Because we can't. I would love to do all the tests on everybody, but not everyone has like 10 grand to drop on testing. So we try to pick and choose. And there are like certain people with, high mycotoxin levels that give off a certain type of anxiety that I can't articulate, but I know it when I see it. And so I want to talk a little bit about this kind of neurological shift that can happen, or even diagnoses of presentation of neurological disorders that really could be tick-borne related.
So I recently published a peer-reviewed research article on 2 patients I had that were diagnosed with Lyme disease. They were both diagnosed with Lyme disease, and they were both started on treatment. And they both started having seizures when I started the antibiotics. So the antibiotics I prescribed actually decrease the risk of seizures. They don't decrease the seizure threshold. They don't cause seizures, nothing else like that. Because, when they started with the seizure, that was the first thing I looked at was what is the seizure threshold with these medications. They each had 2 neurologists that they were working with each. And honestly, they were absolutely no help whatsoever. They were giving more and more anti-convulsion, anti-epileptic medications, and they were not stopping the seizures. One was 14 years old, one was 25 years old. The 25-year-old went into status epilepticus. He almost died. They couldn't stop the seizures. They put him on an Ativan drip. Eventually had to put him on life support and transfer him to a larger medical center here in Connecticut. And it was absolutely frightening. So now he gets stabilized on the anti-epileptics, and so now I add on another medication to try and get rid of this tick-borne disease. And same thing, 2 weeks later, he goes back into having 3 seizures back to back. So now I know this is not a coincidence. This is definitely a Herxheimer reaction from the inflammation that's causing these seizures. And so now I'm trying to figure out, like, how do we get rid of these seizures? And there is no information on this. So I had gone on the Mayo Clinic site. It was the only place I could find any information on seizures related to like viruses or bacteria or anything like that. And I followed the protocol for hepatitis C that was causing seizures in people. And it was, high doses of thiomedrol followed by IVIG. So I did the gamma globulin levels. I did the anti-NMDA test. I did all those things, and I was still getting backlash from the neurologists. They still did not believe that this was all from an autoimmune encephalitis for both patients. And I just ignored them, to be honest with you. I took matters into my own hands because I needed to get these kids
You need to get over that hump. Yeah.
Seriously. So they've both been... One has been seizure-free for almost 8 months now. The other one, the mom changed insurance companies, and the insurance company would not approve the same brand of IVIG. And so just the change in brand, the seizure started all over again. So I was able to get in touch with the insurance company. We got the correct medication re-prescribed, but the damage was done. So now we had to start with the thiomedrol again and then go back to the IVIG. And so now she has been seizure-free as well. But it's been quite a journey for me, quite a journey for those patients, and quite a journey for their families because they're such young adults. Recently, I've been getting more and more patients misdiagnosed with ALS, and that's another, neurological disorder brought on by a tick-borne disease. So Bartonella is really the driver for that. Bartonella you can get from a tick, you can get from a spider bite, a cat scratch, cat bites, horse flies, sand fleas, regular fleas. I mean, any biting insect, they're finding it now in mosquitoes. So biting insect can actually give you Bartonella. And if you already have an immune system that's not working properly, you'll never be able to fight off this Bartonella, because if you look on the internet, it'll say it's a limited infection. Your body just fights it off. More misinformation, so ALS is a diagnosis of exclusion. They have tested you for every other possible cause why you're having this neurological deficit. And if everything is negative, then you're left with a diagnosis of ALS, which is a death sentence.
Yeah, it's
But
terrible.
And in my research, I put that local Lyme testing is not accurate. It was never meant to be used for diagnostic purposes. It was actually used for epidemiological purposes. And somehow the confusion started where people were using it for diagnosis. There's no way to diagnose anybody with Lyme disease with that because you only have 3 bands out of 10 that are related to Lyme disease. So you need 5 out of 10 to be considered positive. We only have 3 that are related to Lyme disease. So you can have 7 other bands positive. It has nothing to do with Lyme disease. It has other viruses, other tick-borne diseases, but not Lyme disease. So I was very grateful that I was able to add that in my paper because I don't even know if that's published anywhere. That's another problem.
Right.
So when a person gets diagnosed with ALS, make sure you find somebody that knows how to treat and diagnose properly. Because what you want to do is make sure you get IGeneX testing done. That's my favorite lab for tick-borne diseases. They're not as good as Galaxy when it comes to Bartonella. So they have a panel of tests that cost $1,299. Which is a huge savings if you added up all those tests individually. So I include the Bartonella in that because if I pull the Bartonella out, these people are going to be paying about $2,500 instead of $1,299. If the Bartonella is positive in IGeneX, that's great. But if it's negative, then I send it to Galaxy Labs and then I'll usually get a positive result. That's another $499. But I'm always trying to figure out how else can I help somebody? How else can I help somebody? What am I missing? What else can I possibly do? So my biggest concern and the reason why I'm doing so many podcasts is I'm trying to get people, whether you come to my office or another office, make sure you find somebody as soon as you start getting these neurological symptoms. Because once you end up in a wheelchair, I have had the hardest time getting somebody out. We were just talking about it before I came in here and I got so emotional about one of my patients that she was being ruled in for ALS because nothing is working. I had sent her to a neurologist. I wanted her to go to Columbia Presbyterian because they really do tick-borne diseases well there, but she wanted to go to Yale. And Yale is probably the only hospital that I wouldn't send somebody to for a tick-borne disease. In the neurologist's defense, they did a magnificent job. They really tried everything to try and figure out what was going on with her, and they told her to return in 6 weeks. So now I see her on a Friday, and she's telling me all this. It was already 6 o'clock at night. So when I called neurology, I left them a message saying, this patient is not going to last 6 weeks. I need something, even if you have a medication for me to prescribe for her, just to be able to manage her symptoms until I can figure out what else to do with her. And Monday morning, I came into her death certificate.
Oh, gosh, I'm so sorry.
Yeah, so I'm still emotional about it.
Well,
this is years ago. This happened probably like 5 years ago, but I'm still so emotional about it.
When hands are tied and like even if it's never just in your gut because this is you've been so immersed in this world, but and even just, we tell the name of the podcast is Inspired Living with Autoimmunity, right? Like it's and a diagnosis like ALS, the hope is taken away with that diagnosis.
Completely.
Yeah.
Because there's no cure for it. There's absolutely no cure for it.
Yeah.
And people are searching for miracles when they have a good diagnosis like that. So, my big thing is I can't produce miracles, but I can do everything in my power to be able to diagnose you correctly and get you on the best path to wellness again.
Yeah.
Like I said, I get the sickest of the sickest people who have been to 8, 10, 15, 20 doctors and just told that they can't find anything wrong with them.
Yeah.
Let me tell you, there's going to be something that I can find. There's definitely going to be something that I can find. And unfortunately, local testing that insurance will cover the testing is antiquated. It's not accurate. It's not as sensitive as the testing that you have to pay for out of pocket. You have one life. We treat our cars better than we treat our bodies. We can replace a car tomorrow. We cannot replace this body. So treat it with the utmost respect and try and give it the best fuel possible and the best chance of survival possible. Even if that means, having to take a loan out to be able to pay for visits and testing and medication and everything else that goes along with it.
Yeah, it is.
Take out a car loan, take out a
They
health
say,
loan.
the true wealth is health, right? Like there's.
It's so true.
Yeah.
You're so right.
It's
Think about
so
the money in the
true.
world. If you're not healthy, it means absolutely nothing.
Yeah. Yeah.
You know,
Absolutely.
there's certain things that money just can't buy.
Yeah. So I want to highlight, because I've listened to a bunch of interviews that you've done, which are amazing, and also explored around on your website and seeing all the amazing things you're doing at your clinic. And I know I've heard you talk about, and I think that this is an important thing for people to understand. When you are treating somebody for Lyme, you mentioned Herx's reaction when we were talking about the patients that were having seizures, but I want people to understand, just like any other healing, there's never a straight line. Nobody would ever, no one, if someone promises you that, run in the other direction if you can. But is it common for when you're going after Lyme and Bartonella and some of these other infections, is it common to, during treatment, see symptoms, get worse before they get better?
Yeah, so there was a doctor, Neil Spector, who's an oncologist, and he ended up with Lyme disease. He was a marathon runner and got to a point where he couldn't walk from his bed to his bathroom. And so he had gone to so many different doctors, like every other patient, and nobody could figure out what was going on with him. And then he found a Lyme literate doctor and found that it was Lyme disease that actually affected his heart. He had to have a heart transplant. And he said that all his colleagues just completely shunned him when they found out he had Lyme disease because it's something that doesn't exist. You're not supposed to have Lyme disease because it doesn't really exist. And so when he went back into practice, he changed his profession from oncologist to Lyme specialist. And he explained to his patients that having a tick-borne disease is like having a cancer. You will get better eventually, but you're going to get worse with the treatment before you get better. And I thought that was a perfect analogy. And I share that story with every one of my patients because I want them to know, I promise you I'm going to get you better. Right. I can also almost completely promise you you're going to feel worse before you get better. And you're going to want to quit the treatment. And then all of a sudden, one day, you're going to turn that corner and you're going to be like, oh my God, I feel so much better. And it just seems like it happens when that person is at their last bit of that rope. They just have nothing else to hold on to. And then the next time I see them, they've turned that corner. Another thing I found is I've been doing some research with ivermectin, and I'm finding ivermectin, I don't know the mechanism of action or how it's actually affecting Bartonella, but people turn the corner so much faster when I start ivermectin. And I start it twice a week in the beginning, then we go to every other day, and then depending on how the person is doing, sometimes I'll go to every day. That has been the best thing for patients with Bartonella. So right now I'm just collecting data. I'm in the data collecting part of it, but eventually I plan on publishing another research study just to try and explain that, a lot of times when we prescribe these antibiotics and these medications, we really don't know why a person gets better, but we do know that they get better and they stay better. And so ivermectin, I think, is going to be another one of those medications that is going to show. And there's so many other reasons why it's used. Like, I have so much research that I've been collecting on other reasons why people are using ivermectin. It's a fairly safe drug. We don't really have to worry too much about the side effects of it. People tolerate it well. It doesn't seem to interact with, I haven't found any medications interacted with yet.
Yeah.
And
it's been around a long time. A long time, for real. Yeah. It can be effective, and then, like you said, also like benign as far as side effects or interactions, or do I think it's the end-all, cure-all for everything? No, there is no magic anything.
I wish there was, but there isn't yet. Yeah. We haven't found it yet.
So I say keep doing the research.
Figured out. Yeah.
Yeah.
And that's it, and if you are, a provider and you're seeing patients like this, please publish, because that's the only way that the rest of us can learn is by published papers. Make sure they're peer reviewed so that they hold weight behind them. Yeah. But, when I was trying to find something on seizures related to Lyme disease, I honestly couldn't find anything. So I'm glad my paper made it all over the world. Actually, I got some information back from the journal that it was published in.
Well, and thank you for taking putting in all of that effort to publish, because like you said, that's that ripple effect that we need so that other providers can learn, like, oh, okay, what does she do? What is she seeing? That is amazing. Are you only working with people in Connecticut in person? How does it work at your clinic?
So I see people in person. I also do telehealth visits throughout the country. For me to prescribe, I have to see somebody in my office once a year. And then internationally, I see patients internationally as well. So right now I have a patient in Australia. I have a patient in Puerto Rico, one in Italy. And if they come here every 3 months, which some do have the finances to be able to do that, it's great. If not, I can work with their provider, and that's what I've been doing with the 2 patients right now, is working with their providers and explaining the whole rationale of why we have to do these things. And, I send them all the literature that they need to feel comfortable to prescribe what I'm telling them to prescribe. So that's been working out really well, too.
Amazing.
Oh, I actually have a patient in Germany too. I just forgot about that one. Sorry about that.
Amazing. And it is one of the gifts of technology, and that we do get to kind of, all of a sudden the world gets small, which is
very
amazing.
Small. Yes.
Yeah.
Amazing. It really is. It really is. And I'm very fortunate that I'm able to do this. I'm very fortunate, that I have my own practice, that I don't have to answer to anybody else because if you work in a different office and you have a medical director, you can only do what they allow you to do.
Sure.
So, I was the first nurse practitioner in Connecticut to open a practice, which whenever you're first at anything is absolutely horrid.
Yes. You're clearing the way for everybody else. It's terrible for you.
Absolutely, without a doubt. But I'm very glad and very fortunate that I was able to do it, and I'm thrilled that I had such a supportive husband who really had my back the entire way.
Well, good. And look at what you're doing. You're changing the course of treatment for people and giving people their lives back, which is priceless.
That's so important. It really is. It really is. Because it's a terrible situation when you have all these symptoms and your doctor is telling you there's nothing they can do because they can't find anything wrong with you. Yeah. I mean, my heart hurts when I hear things like that.
Yeah, and it is unfortunately so common. We say, I qualify all the time, like if I need surgery or, for acute care, Western medicine's great. Like, yes, go for it.
You're absolutely right.
Yeah, that's where it shines.
100%.
Yeah. So
I completely agree with you. But something like this, the mainstream doctors are not educated. They're not taught anything like this, and it's really unfortunate that it has to actually happen in your family for you to get educated on it.
Right.
Because honestly, if it didn't happen to my son, I would be as ignorant as everybody else is.
Right.
Because I wouldn't even know that there was something else going on.
Yeah. Well, we're grateful he's doing really well, and that it made you forge a path that you hadn't planned on.
No, I didn't at all.
Because I really do think, I think our exposures overall, you mentioned mast cell, and we talk about, post 2020, autoimmunity is on the rise, toxins are out, so we're just bombarded with so much more that the need is not going to get smaller for people to really understand how to dig down and find, these tricky, and to be fair, these are tricky bugs. Like, this is not a simple bacteria that you see on a blood test. Like, it's just not. And so we need the people that are dedicated like you. So really, really glad that you're serving, not just in your community, but around the world, which is amazing.
I really appreciate that. Thank you.
Yeah. So I know you're doing podcasts all over the place, but for people that are leaning in that want to hear more from you, where's the best place for those that aren't going to check the show notes to find you?
Okay, so my website is probably the best place to find me. It's the practice of health and wellness.com.
It's awesome. And it's a great website.
Practiceofhealthandwellness.com.
Yeah.
It's all spelled out. And I have my podcasts are on there. My YouTube channel is on there. Yeah. Everything is all connected. My peer-reviewed article is on there. So everything is in one place, one-stop shop.
which is amazing. I'd really encourage listeners to go check it out. And for those that are now like questioning, this is an area I haven't explored before, reach out and find Dr. Cipriano and get some real guidance, because it is a specialty. So, we really use the terminology Lyme literate, but I think a lot of people self-identify as Lyme literate that I would not consider experts in the field. I agree. And so, finding a resource like you is an amazing gift. And really, again, as somebody whose life has been in an ongoing way so touched by Lyme in my family, I just really appreciate the fact that you decided to dig in and help your son.
Thank you so much. I appreciate that. And being a critical care nurse, I'll tell you, that really helped me to figure out how to help people even better, because especially when I was a nurse, and we're talking 30 something years ago, I worked in a non-teaching hospital. So the nurse was it, the ICU nurse was it. The physicians would come in round in the morning, and if you were lucky, maybe in the afternoon, but usually not. And so a lot of it was just a lot of researching, trying to figure out what was going on with a lot of these patients. So I think that was a great first experience for me to get myself to where I am now.
Well, and again, we don't throw Western medicine out when we want to dig deeper and practice functional or integrative. And so they're not exactly. At least that's our perspective. Is the bigger toolbox wins. So yeah,
I agree. I love that.
Thank you so much for your time and sharing your expertise with us and inspiring listeners to go dig deeper, look further, and don't take no for an answer.
Don't take no for an answer. And, if you're, like I said, you don't have to see me, you can go on ILADS.org. You can try and find a provider that's closer to you. You could, I don't know specifically who's in Colorado or anything like that, but at least that way you'll have a better idea of who's around you that will be able to help.
Yeah, absolutely. Well, thank you so much for everyone listening.
Thank you so much for having me. I really appreciate it.
Oh, of course. And for everyone listening who's going to take the time, you can get all the transcripts, links, and show notes by visiting inspiredliving.show. Hope you had a great time and enjoyed this episode as much as I did. I'll see you next week.
Thanks for tuning in to Inspired Living with Autoimmunity, hosted by Julie Houghton, your autoimmune coach. If this episode resonated with you, share it with someone in your life who needs to hear it. For the complete show notes, links, transcripts, and everything discussed today, visit inspiredliving.show. You can also send in your questions there to be answered by Julie in a future episode. That's inspiredliving.show. Remember, it's time to take your power back.